Honorable Prime Minister. My name is Harniha Gulati. I'm from Parvasi Media. Some say it's the hospital's problem. Some say it's the city's problem. Some say it's provincial government's problem. 14 years in Canada, coming from a third world country, working hard, paying taxes, and hoping to make my senior years secure. But I see my mom lying in the emergency corridor, crying in pain, terrible pain, and nobody comes around for 6 hours. Whose problem is it at the end of the day? She says, this is what Canada has to offer. I ask you, Honorable Prime Minister, what system can you create to make it your personal problem and get something done? Do you have a solution in Ottawa? I know you're a kind man. You bring people from all around the world and help them out. We are already here.
Thank you for your question. As you probably know, the delivery of health care is a provincial responsibility. But Canada, as a federal government, is responsible for administering the Canada Health Act, which ensures that health services right across the country are properly delivered. We continue to work with our provincial counterparts on ensuring that they are responding to the needs of their citizens, because provincial or federal, we all serve the same citizens. And that is why a number of years ago we made historic investments in signing health accords with all the provinces that included specific help for seniors through home care, so that people aren't stuck in hospital corridors and get to be at home longer and get the external help that they need while maintaining a quality of life. And we also made historic investments in mental health, which is also a preoccupation for people. On the federal side, in this most recent budget, we also made a significant step forward towards pharmacare, where we recognize that Canadians, apart from the Swiss and the Americans, Canadians pay the highest cost for drugs, for prescription drugs, in the world. And that has to stop. And that's why our investments in this budget will create a Canadian drug agency that will have the responsibility of driving down the costs of prescription drugs. And we've also specifically put $500 million forward for those families who are facing difficulties of family members with rare diseases that require extraordinarily expensive drugs. We know that that is one way that the federal government can step up to support the provinces in an area that has seen extremely rapidly rising costs for medical help. So we are there to be partners of the provinces, but we respect that the Constitution determined that delivery of health care needs to happen through the provinces.
Last question.